post-exertional malaise is the downstream effect of exercise. And I think exercise and movement will improve when we manage the upstream drivers of post-exertional malaise.
Okay. Yeah. Okay. Mr. Chairman, I yield. Thank you all.
Senator Kaine.
Thank you, Mr. Chair, and I really appreciate the witnesses being here. You know, I think it's an honor to testify before the United States Senate. Can also be a hassle, but for y'all, it's an additional burden. It's a burden to come, and as Ms. Beal testified, or as Ms. Vasquez traveling across the United States, or Ms. Heim here with family, you know, you're going to suffer a consequence from having been here today, likely fatigue, and so we don't have a lot of witnesses who have to come over the mountain the way you've had to be here, and I really appreciate it. And I've been dealing with my own long COVID issue for almost 4 years. It's mild, thank goodness. I feel like every nerve ending in my body's in an Alka-Seltzer 24/7, and it is. I can work, I can focus, I can exercise. It's harder to sleep. After 6 months and it not going away, I finally decided, I guess maybe it's not going to. I should see a neurologist, and I have been able to be told this is probably not going to get worse, and it's probably not going to get better, and both have proven true. Two other colleagues, one a former colleague, Senator Inhofe, and a current colleague, Senator Young, we wrote a piece about our own experiences together that I'd like to introduce into the record, if I might, Mr. Chair. And the reason that we wrote it is, Ms. Vasquez, you pointed out, and I think subsequent testimony is underlined, long COVID is disproportionately affecting people of color. Long COVID is disproportionately affecting women. But, you know, we're three white guys. One got long COVID in his 40s, Senator Young. One got long COVID in his 60s, Senator Kaine. One got long COVID in his 80s, Senator Inhofe. And we decided, after kind of finding ourselves on the floor of the Senate, bumping around and wondering if anyone else is having this weird experience we found each other and shared our experiences. And I think the reason that we all started to be public about it is we didn't like that you weren't being believed. U.S. senators get believed. You know, well, by a certain percentage of the population. I didn't have trouble getting believed by a doctor. I didn't have trouble getting believed by a doctor. And I don't think Senator Inhofe did, and I don't think Senator Young did. Our physical reports of our own conditions were given credibility, but so often with women, that's not the case. With minorities, that's not the case. With young people, it's not the case. We've seen the similar phenomenon in maternal mortality when we've had hearings about this. And so we decided, the three of us, to talk about our experiences so that people would understand they're being believed. And Mr. Chair, by doing this hearing today, we can approach some substantive improvements, but also I think doing a hearing like this as a way of sending a message that people are believed. Ms. Beal, I don't want you to say more than you comfortably feel like you can, but can you talk a little bit about this SSDI ordeal and that you've been, I mean, the ADA says long COVID is a condition, a disabling condition that can be one that would either require reasonable accommodations or lead to an SSDI disability determination. But in a situation where you're already low energy, you're going through an extended process where you've already been denied twice. Talk a little bit about how frustrating that might be. And you're a human resources professional who've helped employees do this, so imagine if you hadn't had that background, how frustrating this would be.
Thank you for your question, Senator. It has been an ordeal, like you said. The whole process has been very frustrating. The system is very difficult to navigate. You know, when I'm working on the paperwork, it's very overwhelming, and I can only work on it, but for so long. I set like a little timer for about 30 minutes, because if I go over that, I start getting headaches. So, I'm trying to compile all of my medical documentation to send in, and, both times I was denied, SSDI doesn't give specific reasons why you were denied. So I don't know what it is that they need from me to show that I can't work.
So you don't know whether it's we don't think you're disabled, or you didn't fill out this piece of information right, or you left something blank, or you really don't know.
Right. I don't know if they were able to get in contact with all the doctors. I don't I don't know unless the doctor tells me.
Here's a class of folks with long COVID who really have problems with the SSDI. A lot of people got COVID before we had tests. You know, remember how hard it was to get tested early on? And people who were getting COVID at the front end, they weren't even getting tested for COVID because there weren't tests. And then later, okay, maybe they get a vaccine, and then later a test will show that they have antibodies in their body, but that could be because of the vaccine, or it could be because they've already had COVID. And the medical professionals who are trying to make a resolution about SSDI are like, well, you have antibodies, but that doesn't mean you had COVID. So there's a set of problems that make this, within the SSDI framework, really tough. Now, we've dealt with situations like that in other contexts where we've had presumptive determinations, you know, for availability of healthcare benefits when firefighters get certain diseases that are, you know, because of conditions that are likely to occur in their profession. We give them presumptions that can be rebutted if they're not true. But it is a difficult proof burden, especially on somebody who's really suffering continuous symptoms of the kind you describe. And I hope I'm at my time and over it. And I want to let my colleagues go, but I hope that might be something we could focus some attention on.
Good point. Senator Murkowski?
Thank you, Mr. Chairman, and